Now to the other big story we're following for you tonight. Ministry of Health officials maintain the Bahamas is now in the second wave of the COVID-19 pandemic. Today, an additional 66 cases were added to the record, pushing the number of confirmed COVID figures in the Bahamas to 574. 39 of those cases in Grand Bahama and 27 right here in New Providence. Several details on the COVID-19 pandemic revealed at the Ministry of Health's virtual press conference held earlier this afternoon. Chief Medical Officer Dr. Pearl McMillan emphasized that contact tracing is essential right now for health officials as they continue to monitor the cases. In fact, she said each confirmed case produces 4 contacts, and even in some cases, an individual had about 100 contacts. The Chief Medical Officer details some of the measures being taken to enhance the Ministry of Health's contact tracing system. Now, she also indicated that health officials continue to see record-breaking number of cases during the second wave of the COVID-19 virus here compared to the first.
In this graph, the teal-colored line represents the cumulative number of cases in the second wave, while the red represents the cumulative number of cases in the first wave. You can see the dramatic difference in the slope or the angle of the second wave line compared to the first wave outbreak, illustrating that more people are being infected in a shorter period of time. These figures and graphs demand that we take this second wave seriously and be individually responsible for ensuring the collective good. What does this mean in practical terms? You've heard it time and time again. Now it's time for us all to do it collectively.
The CMO also attributed individual and collective behaviors to directly impacting the spread of the virus.
Between the 1st and the 24th of July, 4,246 Bahamians traveled to international destinations, the majority of which were COVID-19 hotspots. Recall the image showed earlier about how one person can potentially infect many. Our behaviors can put us at risk for getting infected and infecting others with COVID-19. We cannot continue to engage in or condone the same social practices and then be alarmed at such rapid increases in cases.
Well, health officials have also recognized a comparison in the age of patients infected with COVID-19.
In the first wave, 50% of infected COVID-19 persons were 50 years or older. In the second wave, thus far, only 29% of our cases are 50 years or older. A greater percentage of positive cases are being recorded in the 20 to 40 age group in this second wave. Young people are not invincible. Young people are not immune. And so, they too must make a habit of these life-saving practices that we continue to advocate for.
Health Minister the Honorable Renwood Wells also addressing today's press conference, and he outlined why not practicing social distancing can contribute to the rise in COVID-19 cases.
Individuals from Grand Bahama, New Providence, and Bimini all attended a particular funeral, and within a single incubation period, there were increased number of cases on those 3 islands. Let me be frank. While there is no way to ensure zero risk of infection of COVID-19, doing all that we can to minimize risk and stay safe requires personal responsibility. Do not socialize with people who do not live with you. Do not engage in activities that do not respect the protocols of social distancing and wearing masks. There is no way for you to know who is infected, my brothers and sisters.
Director of Social Services, Lillian Quant Forbes, confirming that as of 10 o'clock this morning, shelters across the Bahamas were activated. At this afternoon's press conference, she offered this advice to residents in low-lying areas.
Please, if you know your area floods, then you need to make arrangements for a family to host you. If you find that there's nobody who's willing to host you, then you need to report to one of the shelters so that you and your family can be safe. The greatest thing that we need at this point in time is for everybody to be safe.